All right. So welcome to our webinar on finding grant funding and making those applications. And I'm going to go ahead and share my screen so we can go over a few basics. And I'm so sorry it's not fancy in a presentation. I just put it in a Word document, but it'll work. So that's okay. I'm also going to pull up some websites that I had arranged to show you all.
Hey, Nicole.
Hi, Emily. Hi, and hi, everybody.
Good to see you.
Good to see you too. I love joining these calls just to hear what everybody's doing and working on and keep up to date. So
I know, I'm excited to be here too.
yeah.
And Emily is our first person experience of having applied for grants. I've also done quite a bit of grant work. I have worked on, kind of the $10,000 grant range and then, up to $250,000. So kind of a range of different types of grants. And I think, the first question everybody has is, how do I find these grants in the first place to even know what's out there? And so I wanted to show you a couple of resources that you can use. If you come over here, there was this organization called the Foundation Center, and they ended up just combining with GuideStar. And if you go to their website, they've got information for nonprofits about different funding opportunities. And they give some really great tips there about, it's important to look at the subject of a funder. Are they interested in the same types of things you're interested in? Because there's nothing worse than like saying, oh, well, maybe this funder will work, and trying to coordinate your mission to theirs when it really doesn't fit. And you really want to find people who are a good match. You also want to look at populations served. So for our purposes, it would be people with disabilities, people with Down syndrome, and then also geographic region. And those are sometimes the best in your circumstances because you can form personal relationships with the funder. And that's one of the best ways to actually is to cultivate an ongoing relationship with a funder who can sometimes give year over year, depending on their level of interest in what you're doing. So there's this foundation directory online where you can find a bunch of different grants, and you can see what a sample record looks like right here. They'll tell you all about the funder, what their funding interests are, other funders to consider that are, match based on that. And then it also tells you the staff and job openings are. And then basically you take that information, you go to their website and you do more in-depth research about who they funded in the past. Do they look like you? If they do, then that's probably a good sign if they're interested in other disability issues. But it does cost, this particular service does cost money. So I would recommend that if you go this route and you want to do it for the least possible amount, you just get the monthly plan because you're billed monthly and you can cancel anytime. So basically you could say, okay, we're just going to spend a month a year looking at funders who might match us. And then you're paying $200 a year as opposed to, some of the bigger plans for bigger organizations. So that's kind of one way to start. There's also this article that I will share with you all from Instrumental that's got lots of different tips on getting grants and looking for, in your region. Sometimes it's looking at employers in your region. So for example, you may have, so in Kentucky, Humana is based out of Kentucky, and that's where I work. And so they have a big humanitarian push and different grants that they give. And so you want to look for companies in your area that are kind of the flagship corporations. In Atlanta, we've got Coke, and so you look at them and see if they have any charitable giving that they might be doing as well. So and then, I did want to cover one other type of grant, and that is federal grants. And you can go to that, you can see those at grants.gov, but I do want to give a huge caveat for government grants. They are very complicated, and they require a lot of documentation, and usually they don't give them to you unless you are already an existing you've already demonstrated that you can handle a federal grant, which is hard because it means it's hard to get in there in the first place. So the best way to coordinate those is to have a partner like a university that has more experience with getting federal grants, but they're usually often looking for community partners. And so you can reach out, for example, if you go to aucd.org, which is the big parent organization of our program. You go to USEDS and LIND programs, and these specifically have disability areas of focus. And you can look for wherever you're at, and we'll use us as an example. So go to Kentucky, and you can see the names of those who are working in that area. And often there will be someone who is a community education director or something. And in your particular state, you can reach out to that person and say, hey, we would be interested in working on some projects with you. Would you maybe, be interested in helping us look at some federal grant opportunities with that? And they may be able to wrap you into a grant. They may not, but it's worth reaching out because you definitely want to have a partner when you're applying for a federal grant if you have one that you're interested in. So that is kind of the first step. And then when you're actually applying for a grant, you want to make sure that you're reading it very, very carefully and following all the directions. And this is something I was scared of doing when I first started applying for grants. I was like, oh, I don't want to ask questions beforehand because they'll think that I'm stupid and I don't know what I'm doing. And I was really just kind of nervous about that. And that was totally wrong on my part. Absolutely. Don't be afraid to talk to funders, ask them questions about, like when I was applying for the PCORI grant, it was like, we actually sent them a 1-pager of our idea and said, does this sound like something that might be a PCORI funded project? And they said, well, actually, you're on the right track, but not quite. And they gave us some ideas for how it would actually be more applicable to their funding priorities. And we found that the way they interpreted it was always also something we were interested in. So we were like, okay, so we reshaped what we were doing. So we didn't spend all that time writing a huge grant only to be told it didn't match what they wanted to fund and their mission. So definitely don't be afraid to ask questions beforehand. If they have any educational opportunities, some of them will host like listening sessions or webinars about what their content is about, or they'll have videos on their website. Make sure you're looking at that stuff and getting really familiar with how they talk about their priorities, because that also helps you to know how you're going to talk about it. Like if they're using a lot of data, then you may not want to make sure you're using data. If they're using, referencing a lot of studies, or they're doing community partnerships and they like to see people working together, that helps you know how to craft that grant. Like we need to have community partners if that's what we're going to do. And so on that point, some kind of tips that I've learned over the years are to get letters of support from partners when you're submitting your application. So then they know that you're going to have a broader reach in what you're doing. You also want to make sure you're collecting data. So let them know how many new and expectant parents you support every year, how many you are supporting as compared to how many you should be supporting based on demographics, and be like, hey, we're missing half of our people. And if we could get funding from you to do these particular activities, we think we can reach these people. So data can really help you. You also want to have studies to back up what you're claiming. And so I actually sent you all a bibliography that I did for school, and yeah, that's kind of fun. But I sent that bibliography so you have kind of the top, I think it's 10 or 15 studies that I use a lot when I'm applying for grants. And they're all related to medical outreach and new and expectant parent support. And so that helps you to build your case for your funder, and also the history of your organization. They like to see organizations that have an established history in the community, and to be able to say, hey, we've been doing this work for 14 years or however long it's been. So those are some different ways that you can be working toward grant funding. And so now I'll give you a few minutes to ask questions, and then I'm going to turn the time over to Emily to share what they did in their local organization.
No questions?
Don't be scared. Okay.
Okay. Thanks. Thank you, Stephanie. Thank you for that, that bibliography that you put together too. That's super valuable. Okay, so thanks for having me here today. I think, so I've been a little background on myself. I'm the executive director at Gigi's Playhouse in Western New York. But prior to that, I had started a not-for-profit called 21 Connect. And prior to that, I had a son who was born with Down syndrome. And, you know, like probably some of you on this call, or you, everyone on this call knows somebody, of course, had a really negative prenatal diagnosis. So, you know, started doing the work, like, how can we impact change in this area? So, you know, that was sort of the reason I started 21 Connect, was to really do some work with the medical community, OBs, pediatricians, really start giving them education around this situation, which is when I met Stephanie and Nicole. We're currently working on a Down syndrome information bill in New York State. So, been going at it for a long time, this kind of thing. But what I found was really when I started making traction, when things really started changing, was when I started working in collaboration with the medical providers in Western New York. So in the first, 2-3 years, I was teaching them and telling them what they needed to do and that piece. But then I really started gaining some relationships, especially, in our hospital that takes the cases locally that are the highest need. I think we all have hospitals, children's hospitals in our areas where, you've got that high risk pregnancy where people are going to deliver at that hospital. So, and there's specialists involved in this whole community of medical providers. So, I gained some relationships there. I think the key to grant funding that we kind of forget is we think it's this technical job where you have to be able to write, you got to find a grant writer and but I really think more of the work is in the relationship building. I had someone tell me in the past, it's kind of not rude, but if you're working locally with people, it's really important to actually just check in with them and first say who you are and what your passions are and what brings you to this. If you have a building, invite them to the building, or, can you meet for coffee? Just first steps. It's almost like, don't just ask for money, first get to know them. So that's sort of what happened for me. So, we saw a great need for medical services in our community. So I collaborated with this team of medical providers to bring a Down syndrome clinic to Western New York, which was huge. But that's not necessary in getting funding for this grant work. So what I found to be really valuable was that hospitals have foundations that work to bring funding to the hospital. So I worked with the Oishei Children's Hospital. But they had a foundation called the Children's Foundation, and the Children's Foundation does grant raising, gets grant funds for Oishei. So my foot in the door was to become community partners with Oishei. And like I said, you don't need to start a clinic. It could just be that, you met a couple of doctors there that seem to care about this work and want to make change, and you develop relationships, and maybe, you start presenting at the hospital or start talking to specialists about, the language we use around disability, that whole piece, whatever. Start a conversation with your hospital and try to gain that relationship. Now, from there, the foundation, I met the foundation and I invited them to the Playhouse. And we started brainstorming ways that we could bring funds to the Down syndrome community that would be most beneficial with this relationship that we had, right? It was a Gigi's and Oishei collaboration. What funds do we need? Well, of course, I was like, yes, we need funds for prenatal and postnatal supports around the Down syndrome diagnosis. A lot of these hospitals are dealing with the real little babies with Down syndrome. So it served them and it served me. So what ended up happening was we didn't just ask for resources, right? Like for letter case resources. We did ask for that, but we sort of wrapped it up into a big package so that it was more appealing to funders. So we ended up, the foundation and myself, we wrote a grant collaboratively for Gigi's and Oishei, and we ended up getting $45,000. And in that sum, I think $10,000 was allocated towards letter case materials, as well as so it was the first 5 years booklet, and it was also the prenatal screen booklet. So that was a portion of the money. We got a certain amount of money. We wanted to have counseling and support for people who just received the diagnosis, navigating the next steps through the pregnancy, once the child is born, the whole way. So that was built into the grants. Then we got funding for infant programs. So, you know, when the little ones with Down syndrome are born, we had a program in place that they could come to and meet their community members. And I'm going to throw a lot at you guys, and then we had an early intervention collaboration. So early intervention is the providers. I know we all call it something different in different states, but they come in and work with your child for those first 3 to 5 years of life, providing services in your home. So we had an early intervention collaboration with that infant class. And again, as Stephanie was talking about, collaborations, anywhere you can bring in community partners and you see what you're doing is far reaching. So we tied that piece into it. We also put medical outreach as a part of that. So, you know, when we're talking to hospitals, we're talking to OBs, when we're doing all this work, we're actually getting paid for it through this grant funding. And then we also had a portion for marketing that was in this grant. And then we also had a basket program that we funded. So we sort of made it a very rich, big ask. And sometimes big asks are good because it shows you have a good plan in place, and that you're going to get the work done. And it's not just the booklet, but there's other things involved that you're going to do beyond that piece. And, you know, and it was great. So, and then of course we had the backing of that major hospital with us because they also felt a need for these kinds of services locally. I'm sure we all have a need for these kinds of services locally. And so that in a nutshell is like sort of the funding we asked for, the amount of it. You know, and for me, it was a journey of relationship building, I guess maybe, you know, it doesn't have to be, but I found that to be really valuable. You know, to rely on the community at the same time showed that, you know, it just wasn't a singular kind of thing. So I don't know, I'd be happy to share the grant and what the language looked like for people who are interested in something like that. You know, or put it down on paper, the steps we took and the pieces that we funded, beyond just the resource piece. But yeah, that's sort of in a nutshell what happened. And if anyone has any questions or anything I can sort of delve deeper into, feel free.
I mean, first of all, congratulations. And I think you were so right as far as making sure you've crafted a whole support program and context for what you're doing. And I think toward that end, it's really important to be aware of any budget limits also that a funder might have. Like one thing that we encountered, we received a grant to ship, or not to ship, but to provide materials to all of the clinicians in Kentucky. And we were going to mail them, and we realized the grant didn't cover shipping. So we were able to pay for printing and production, but we weren't able to pay for shipping. So that required us then to figure out, okay, how are we going to pay for that? And do we have some strategic partnerships? Now the grant, interestingly, would cover shipping materials. So like the envelopes and things like that, but it wouldn't pay for the actual shipping costs. So what we did is we ended up reaching out to the local Down syndrome organizations in Kentucky. And we also reached out to the Spina Bifida organization because they had been included as part of our Down syndrome, which became a Genetic Conditions Information Act. And so what we did is we said, okay, we've got the shipping, we've got all the shipping supplies covered, and we're providing our materials. If you want to send us your pamphlets, we'd love to send your pamphlets out. And then will you also help us with the shipping costs? And so we ended up getting, you know, splitting up those shipping costs among, I think, maybe 5 or 6 organizations. So like you said, and that goes back to those relationships, right, Emily? And so we said, okay, will you cover that? And then the funder covered the other piece of it. So I think that's, again, where those relationships are so important, because and also the budget items, and talking to your funder, and then also figuring out what you can do with your partners. And I think it ends up being better for everyone, right? Because we wanted all of those doctors to also be getting information about the local Down syndrome organizations and the Spina Bifida advocacy group. So it was a win. I mean, to use that phrase, right? It was a win-win for everybody. I hate that phrase, but it was.
Yeah. Yeah, totally. And the other neat thing about getting grant funding is that it sort of pushes our cause through, because I say to OBs, I have this massive grant funding that I have received from funders to help you do the work that you need to do. Like people with a lot of money believed in this enough that they put it forward. So you too should be stepping up to the plate and receiving this, and, you know, sort of, because we have found locally in Western New York that it's really hard to tap into the OBs. Like you can't contact them, you can't find they don't have email addresses. Like it's been really difficult. That's another way that it's been valuable to have a collaboration with the hospital, because when you know, make a good relationship with one of, you know, the chief medical officer is actually someone I got really close to, and he could give me all his, you know, emailing lists and telephone numbers. We were really able to tap in that way. So something that sort of missed my radar in the beginning of this journey when I started out with 21 Connect was, I'm going to just keep asking them to let me teach them about this and let me give them these resources. And then I realized, wait, I need to bring them in to have them help me, you know, and share with me their expertise too. And, you know, and then along the way too, we found an amazing doctor. There's such great doctors out there. And she helped us to create a postnatal, prenatal diagnosis script that is so powerful that I use. And that has been, it's a little off topic, but that has just been another amazing benefit of really working in collaboration with the medical providers. They have this great knowledge that I think in the past I was always a little irritated with the situation, you know, and missing the point that there just is a lot of help to be had out there. And so if you come to them, I'm the local Down syndrome organization, or I do this, or I do that. We need your help. We have this situation. This is the case. How can we move forward? How can we get funding? How can you help us? You know, we will rely on your expertise as well, sort of a humbling type thing. It goes a long way.
And I think you're so right, as far as kind of, there is a certain level of gravitas when you come to them and there is some funding as far as spreading the work. So when we got our Kennedy Foundation grant, to be able to go and approach the medical providers, the leaders of those organizations, and say, hey, you know, the Kennedy Foundation believes in this too. So will you please join our consensus group? It really does help to have that, the support of that funder. But then, but like you said, though, there are all of these organic outgrowths of those relationships. So once we started working on the grant funded project together, then it was like, oh, okay, well, now we're going to publish together on our findings. And now we're going to present at a conference together and talk about what we learned. And as you move from, you know, the first sparks of those relationships, it becomes some really solid partnership, colleague type connections. And I think that cannot be underestimated. You know, it really does help get through some of those barriers that we face a lot when we first try to approach the kind of medical establishment, right? So I think those are such great suggestions.
Mm-hmm. Yeah, thank you. And then again, you know, remember that your hospital has a foundation and you're a community partner, and they're supposed to be making community partner relationships. It's part of what they're supposed to be doing if they're a good hospital. So tapping into that is huge.
Absolutely. Does anybody have any questions?
I had a question for Emily.
Yeah. Hi.
Emily, would you be willing to share the prenatal postnatal script you guys came up with? We're kind of at the beginning stages in Idaho of getting out to doctors, and we've done like stuff informally, but more making a formal plan so that we can, in our part of the state, we're kind of starting it and then we can spread it to the other parts of the state.
Absolutely. Yeah. You know, I have found that after everything is said and done about guidelines and what we should say and what we should do, everyone just wants a script. They just want the words because it's just too much, you know? So exactly. Yeah. How do I share that stuff? Can I just like email that out to everybody on the invite after that? Is that okay after this call?
I think because I blind CC everyone so that you're not getting like a bunch of responses.
Yeah.
If you send it to me, I'll send it out to everyone. And that way it'll also reach those who weren't able to attend today. I'll send it out with the recording. So everybody has access to that. The other thing that I'm thinking might be helpful for you, Mary, and this will probably go along with your present, you know, when you're sharing next month, but Washington State I know they at least did a poster presentation of the different ways that they engaged in outreach after passing their prenatal Down Syndrome Information Act. And I think that, they kind of quantified how many responses they got after doing a webinar, how many responses they got after doing a social media push. And so then you can see what were the most effective strategies that they used.
That's awesome. Yeah, we actually have a meeting with them in a couple weeks, a Zoom, because our Northern Idaho is Susan. And
Yes.
the person who did most of that is also in that organization, but on the Washington side,
Gotcha.
I
Okay.
believe. So
Is
yeah,
that
but I'll,
Amanda? Is that Amanda?
yes, Amanda.
Okay.
So, but I'll reach out to her before, because she's going to do a meeting for like 8 of us. I'll reach out before and make sure to have her include, it was a poster presentation, did you say?
Yeah, and I can look through my emails because I'm pretty sure they sent that to me after they did it, because I provided them with some data in order to do that assessment. Because a
Okay.
lot of times what would happen is they would give those presentations and we would end up getting the requests for books, but they also had a stash of books and they wouldn't get requests. And so they were like, well, nobody's requesting anything. But because I collect data on who requests them, and I knew that they said they heard about it from Washington Department of Public Health, I was like, okay, this is actually what happened. Because, and that's a way that we can help too. I mean, there are ways in which we can help those departments of public health or, the hospitals also collect data. And because they're trying to keep track of that stuff too.
Absolutely. Okay. Thank you so much.
No problem. Any other questions? Okay, well, I'm going to put a question out to you all. Who else has done grant applications or been awarded any grants?
We got a $10,000 one, but not for, we got it for more like it was for Ike and Bike, so it's not for medical outreach, but it was an Elks grant, and I think they have Elks everywhere, right? Yeah, so they do just as a side note, sorry, this probably doesn't pertain to this, I just realized, but anyway, they do one for like things that have to do with OT basically. And so in our state, it's 10,000. I don't know if other states have it, but it might be worth looking into if anyone else has Elks. And we weren't even really connected with the Elks. We just saw the grant come up and we applied for it, and then ended up knowing a lot of the people who were in there, and we got awarded it. And it was super successful, and sent them stuff and created a partnership there. Like you were talking, Emily and Stephanie as well. The partnerships are definitely what make the biggest difference. And then we also have a hospital who has a foundation, and we have found that they we're going to write after you were saying this, I'm like, oh my goodness, why haven't I reached out to them for money for this, for grants for this? But they like to support really anything we do, just because people with Down syndrome generally, I think, need medical, they're just in the medical community. So they'll support stuff that's not even part of specific medical things.
That's fantastic.
Yeah, that is. It's funny. It's like, I didn't realize it either. Like, it took me so many years until I realized the Children's Foundation, is the foundation. I thought I don't know. I didn't know what I thought, but when I finally it struck me, I'm like, yeah, they can totally give us money.
We've had a lot of success applying for grants from community foundations. So we cover 44 counties throughout the central part of Indiana. And we have applied for specific community foundation grants, like it's fairly small dollar, for like $1,000, and then use those to provide new parent packets and resources just to the hospitals in that region and to providers in that region. So it's worked really, really well.
Awesome.
Yeah, the other one in our town that will do stuff is Eagles, the Eagles. Elks and Eagles. I get confused all the time on who's who, but try to keep them straight.
And there are a lot of community service type clubs like that. I think Eastern Star, my grandma was part of that, and they gave funding. Kiwanis. I mean, there's lots of different groups like that sometimes have funding opportunities.
I was just going to say that we got one when I was with the Down Syndrome Association in Mobile, Alabama. our society, we had a grant from Global Down Syndrome, and
Mhm.
it was specifically for an etiquette and was it an etiquette class for our kids? Like we had to present, the entire program, and our kids were able to do like, they do kids in middle school, usually they do like an etiquette class for them. And their final event was going to a restaurant and doing everything else. It was really cool. I'm hoping to do that in Georgia too at some point, but yeah, it was really nice. And we got presented with it at one of the conventions for the National Down Syndrome Congress. So it was good.
Awesome. I'm so sorry that was loud. Let me turn that off. But yeah, I'm loving all of these different ideas. And I think that, I think ultimately, if you you really, especially if you don't have a whole lot of staff, I mean, maybe even think of it as sort of a once a year, gosh, we're going to check on the Foundation Center and see what might be applicable and look through some of the different opportunities on our area and study that. You might have a particular volunteer who's a writer or who has an area of interest where they might be able to help you. So those are, or if you have someone sometimes who's interested in medical outreach, but they're not quite, they would prefer writing rather than approaching people directly. There are lots of talents and skills that you can access even as a small organization. So I hope that these ideas are helpful to you. And I hope that, and I'm curious if any of you have any ideas that you came up with as you were listening that you want to try.
I'm definitely going to check out the elk.
Okay, so I know that I actually happen to know you have a very robust Elks Club in Valdosta. And I know people who are in leadership there. So if you need any help with that, let me know.
Oh, yes, definitely. Thank you.
Very nerdy that I randomly know that in South Georgia, but I do.
I apologize, my background's loud. I'm living in a house that's half built. Anyway, long story. I like the idea, Emily, that it's not always a bad thing to ask for a larger sum of money that's more robust and includes everything in one, not necessarily everything, but a whole bunch of things in one, because it shows that thought. And the medical, our hospital foundation, they'll give away larger chunks of money for grants, but we always tend to ask for smaller amounts, mostly because I feel guilty for asking for money. And so I think, that putting that concept out there, where we're starting our medical outreach in a more formal manner right now, I really like that. So I might pick your brain, maybe get your email from Stephanie, on kind of more, if you're able to just, share some of the things you used, so we don't have to reinvent the wheel.
Totally. Look, I'm happy to share the grant, it doesn't, I'm totally happy to share it. You can look at it, pull pieces from it if that works for like what you're trying to do. It's funny, and I totally get you, Mary. Like for the longest time, I was like, oh, it's 5,000, maybe I'll ask for 3,000, but then I started to realize, well, sometimes, funders want to hear that they'll give you 5,000 of it, but then you have another 10,000 ask out with somebody else so that they're not the only one in on the money, right? And that makes them feel safe too.
Okay, so 2 points you both really reminded me of is one, having a sustainability plan makes you much more attractive to funders.
Yes.
Yes, if you can say, okay, we're going to start off and you are going to get us started with this piece. We have this plan in order to continue growing this program. Okay. And so, an example might be that we are, okay, so we're going to have you get us started with this, and then we are going to donate a percentage of our buddy walk funds or whatever it is toward this initiative in the future for our organization. Or, there are lots of different ways you can build sustainability into your program, but they do like to see sustainability. The other piece the other thing is we have this mentality in the nonprofit world that it's dirty if we charge money for our time. And I want to point out a couple of things about that. Number one, it ends up being kind of sexist, because look at who's on this call right now. And that means that you don't, that we
It's true.
presume that our time is not valuable.
Mhm.
And that can be damaging to our organization, because it means that our program often doesn't end up being sustainable, because you're relying on volunteers that get depleted, because they're having to arrange for childcare. They're having to arrange for all of those things. And it is not dirty to ask for human resources funding. In fact, grantors and funders expect it in most cases, because they want to know that somebody's going to be dedicated to that work. So don't be afraid to do that. I was like that for forever. And now working at a university, it's like, no, you have to build in staff time. So don't feel dirty about that. The other thing is build in equity. A lot of us as Down syndrome organizations, we know that there's a lot of white representation. We also need to make sure that as we're looking at these grants, we're also looking at opportunities to make our organizations more diverse. And so that's the other thing, is you can say, look, we really want to make sure that we are having not only the staff that are currently working, but maybe if we don't have diverse staff, we want to have someone who can meet those needs. Like if we have a lot of parents who are Spanish speaking, we probably should be hiring, a Hispanic mom to be providing some of that support. And that's actually one of the big grants we got at Down Syndrome Association of Atlanta 20 years ago, was for our Madre Guia program. And that was to train and pay some of our moms who were Spanish speaking to provide support one-on-one to some of our new parents. So that's the other thing, is make sure that you're looking at those opportunities to grow our programs that way.
Yeah, I always tell myself before I ask for a lot of money, because it is so against my nature and it feels so horrible. I realize I'm not going shopping. Like, I'm giving this to the Down syndrome community, that not to me. And then I get my head straight and I'm like, all right, now we can go ahead and be bold, because it's not for me. It's for, the people I serve and my child,
Absolutely. I mean, honestly, there's nothing I would rather give my own money to. So
Right.
it's okay. It's okay to ask for it. And so I want to give you all some time to go into your breakout groups, and we have 15 minutes. I know some of you haven't joined the Peer Mentor program yet, and so you might not know where you want to go or want to go yet. I think we've got several of you in here, but I'm not sure. Let's see. I'm just double checking my list. Do we still have Laura? We do. Okay, cool. So I'm going to create the breakout rooms, and then I'm going to give you the opportunity to join. I'm going to share my screen. Actually. Yeah. Hold on just a second. I'm just going to get this set up for you guys. You can kind of see who's in which group. And then if you would like to join, then you are welcome to pick which group you want to join. So you can be in 1, 2, 3, or 4. Number 1 is our large groups. Number 2 is our second to largest groups. 3 is our medium-sized organizations, and 4 is our serving smaller areas. Now, these are just based on population and geographic region. So if you want to join the different breakout sessions, you're welcome to. Some are already assigned based on people who have expressed an interest. And if you decide you actually want to do it, I'll put the link to joining a peer mentor group in the chat. So I'm going to go ahead and create those rooms, and then you can go where you would like to go. If I can get back to where Zoom does that, there we go. All right. You should all have the opportunity to go where you would like to go.
Thank you, Stephanie.
You're welcome. Have a great day, everybody. Thank you.
Thank you.